So we're very blessed in our family. We don't feed our kids sugar. We spend probably $1,000 a week on food, groceries, all that. For a family that says, I want to feed my kid.
Yeah.
Avocados, coconut milk, I want healthy fats, salmon, but I can't afford it.
Right.
Outside of what we want to do from a public policy standpoint, is it possible to not feed your kid Lunchables on a budget?
We go through it step by step in the book. I have two messages on that. Number one, there is a bottoms up here. We're getting systemically screwed, but to a mom, a lower income mom, who says that
My
I can
heart
only,
goes out to them.
it does, but I want to be clear. If she says I can only afford Lunchables, my response would be, at the highest level, it is personal responsibility. You are poisoning your child, and you are setting your child up for a life of more metabolic dysfunction. If your child gets diabetes by the time they're 30, they're going to die 15 years younger than an average American. They're going to have a 4 times higher chance of committing suicide. They're going to be a less happy, more tortured child. We are poisoning our children at scale. And to that mom, I would say it is your responsibility to do whatever you need to do to not feed your kid ultra-processed crap. And it just literally gets down to that. Not even getting organic or this other stuff. If you can just take the 70% ultra-processed food is the average child right now, take it down to 20% or below, your child is going to demonstrably live a much healthier, happier, more productive life. And I do think we need to be honest. Like doctors, right? When it's about a drug or about a pharmaceutical injection, no cost is too high, and it's not worried about the mom's circumstances. When the medical system talks about prescribing drugs, there's no equivocation. We need that same type of communication about food. Why is the media censoring anyone who questions a pharmaceutical product, but not taking that same stance to metabolic health and food, and kind of a flippant attitude about it's kind of a foregone conclusion that kids are going to eat poisonous food, when 9 out of 10 killers of Americans are chronic conditions, and 33% of young adults now have prediabetes, and 50% of teens are like it's actually a tone of the medical system. So what should happen immediately is every single doctor with a child who's metabolically unhealthy or overweight should be really clear with the mom that she is setting that child up for failure. So we need actually top down bottoms up, obviously empowerment, to talk to people like adults. We're poisoning our kids. And then my heart absolutely goes out to that mom. And from the top-down policy solutions, President Trump and the RNC platform, most people didn't see this. There was one big line on health. It said we support benefit flexibility. And that's what we were talking about with HSAs. A single mom should be able to have an account where it's not just top-down, your kid needs drugs. Right now, Medicaid is like, okay, your kid has this, drugs, and they wait for the kid to get sick. What if, and this is what President Trump's talked about, this is what's in the RNC platform, what if people had flexible accounts where that mom could actually choose, to invest in exercise for her child, to invest in actually research, supplementation, and actually keep that kid healthy? I believe if we empower Americans with their healthcare dollars and see these medically valid interventions, food is a medically valid intervention. Exercise is a medically valid intervention. The problem is we have a one-size-fits-all system that does not trust Americans and waits for them to get sick and then jams drugs down their throat. That can be unwound very quickly. But yeah.
So the mom that doesn't have the purchasing power that she wished she had, I agree. There's a way to make it work.
There is.
There's not as bad options out there, correct? There's growing startups that have organic type competitors to juice boxes. Organic. So what then? I know you wrote this in the book, but advice or direction, farmers markets, not being at some point. It's also, are you just being lazy and you want the easy way out?
Yeah. So as Casey talks about, absolutely, like we've had, and she talks about this very eloquently, that feminism has convinced people that it's somehow lesser to cook food for your family, and we've absolutely been destroying like at-home cooking. So I think that is essential, somebody in the partnership doing that. And then what do you buy? You buy pasture-raised meat, ideally. You buy organic fruits, vegetables, nuts, seeds. You buy stuff that isn't in a box. I mean, fundamentally what we talk about there is, you can get deeper. You can get into the omega-3 versus omega-6 profile. You can get into what type of antioxidants you need. You can do personalized blood tests for just a couple $100s and see what kind of nutrient deficiencies you have, which absolutely tie to disease down the road, and look for food that matches those needs that you have with your food. But fundamentally, and we talk about this, and this is our big message, if you can get your ultra-processed food consumption down to your family and figure out, inexpensive ways to bulk buy beef, to bulk buy some vegetables, and cook that for your family as much as humanly possible. We also go through packaged and fast food alternatives that are healthier. But you've got to get the ultra-processed foods, there's 3 ingredients, Charlie, that I would really harp on. It's added sugar, it's seed oils, and ultra-processed grains.
Would you say high fructose corn syrup too?
Added sugar, I would so
in that
there's
category?
50 names for added sugars, and then high fructose corn syrup is one of the worst offenders because fructose actually makes us not want to eat more. It actually hijacks our biology.
It subsidizes obesity.
So there's 50 names for sugar. Then seed oils is really inflammatory, very cheap oil, not used in much of the rest of the world. I think very problematic.
Is it true it came from John D. Rockefeller?
Yeah, so it was literally a byproduct of oil production. They actually used it as engine lubricant, and John D. Rockefeller lobbied to have this basically classified for human consumption because they had so much of it, and it greased the machinery that he used. So he invented the seed oil industry, and now seed oils are the top source of American calories. Now, again, I want to be clear. This is what we're talking. What I'm advising is there's policy implications here, but we at least need to all be on a common knowledge about the facts. It is probably not a good thing that the top source of American calories is engine lubricant that was created 80 years ago, and we're not evolutionary made.
Again, I'm not a liberal, but I will say though that the higher up the income ladder you get, the more concern I see for healthy eating. The lower, they say this is too expensive, it's too much. I see the byproducts. We'll talk about this after the break. The healthy food stores like True Foods, for example, which I'm sure you're aware of, tend to be cloistered in higher income areas. We'll talk about that after the break.
Well, it's a good thing to unpack.
How do we get all income levels to care about it? Because right now it's a luxury belief. Luxury belief for the rich being able to go to True Foods, have edamame guacamole and an ancient grains bowl with all naturally sourced stuff, and a single mom in the West Valley can barely afford her rent. So I'm saying getting her to care as much.
So this is my framework on it, Charlie. I think the fact that we see not poison your kids as a luxury belief is how far we've gotten away from, I think, the reality. If you can absolutely stereotype, guacamole and organic quinoa, but if you talk to that, you tell me, you're talking to a lot of them, if you talk to that lower income voter,
they care about
they're
their kids
very
so
concerned
much.
about their kids.
Of course. It's just there's an exhaustion and fatigue, and there's just a financial despair.
So I think the Make America Healthy Again movement that is now brewing
Maha.
It is actually, there's a couple steps before telling that voter to go to Whole Foods and buy organic quinoa. It's actually, we need a political movement that's fighting to protect kids. And right now...
Perfect segue.
Right now, Michelle Obama was actually right that schools, kind of subsidizing really toxic ingredients for kids was a problem. She actually got bought off, but they got to her and she shifted to exercise and got away from
went
food.
From eating to just move.
And it was too much heat. Like the federal school lunch program is one of the largest sources of American calories. It has no dietary guidelines whatsoever. If we're going to spend that money, we shouldn't be subsidizing toxic food that's going to cause trillions of dollars of downstream health impacts. It's not conservative or liberal to have an opinion about that. So what I would say to that single mom, and I think this is really the issue that I'm really pushing and I'm advising on, is it's not about lecturing anyone on food. It's about creating a political movement that's fighting against the corrupt forces that are profiting from poisoning and drugging our children. And we can have a very systematic policy platform to chip away, but this is the problem, right? And I think this does connect with that voter. There's forces at work that are making a lot of money by that poor child being sick. A poor child who's a woman dies 15 years younger than a rich woman in America. That is predominantly because of our toxic food environment. And there is many, many things we can start to do to root out that corruption, those forces that profit from that kid being sick, well before lecturing them to go to Whole Foods.